Hi, good day. I am Dr. Vidhya Mohandoss, consultant psychiatrist of Kamakshi Memorial Hospital. I would like to talk about mental health and women. Are women more vulnerable or more prone to develop mental health disorders? Really no. Nature has selected women for the most responsible activities like bearing children, taking care of children. So women are definitely more mentally stable and strong compared to men. But there are certain periods in her life where she becomes a little more vulnerable to develop mental health disorders. The first one being her menstruation. Now, just before the period of menstruation, which is called as the premenstrual period, there are a lot of hormonal changes that happens in a woman's body, because of which she might develop a disorder called as premenstrual dysphoric disorder. Now, this premenstrual dysphoric disorder is characterized by symptoms like intense irritability, anger, poor self-esteem, poor sleep and appetite, sadness for no reason. Now, this period lasts only for 5 to 6 days, and it becomes better once the period onsets. So, this mental health disorder can be easily treated with relaxation exercises and medications if necessary. The second most vulnerable period in a woman's life is her postpartum period, the period immediately after delivery of kids. Now, this postpartum period can have three kinds of mental health issues. The first one being postpartum blues or postpartum anxiety. This is very common disorder affecting about 80% of women in the postpartum period. This period is usually characterized by intense anxiety about the child's growth and development, about the child's bowel movements, about the child's feeding habits, poor sleep and appetite in the mother. Proper counseling by her gynecologist and the pediatrician is by itself enough to tide through this postpartum anxiety or postpartum blues. The second most common disorder in the postpartum period is postpartum depression. This is very important because it affects around 30% of women in the postpartum period. Depression is characterized by feeling low, loss of interest in pleasurable activities, poor sleep, poor appetite, most importantly, loss of interest in taking care of the baby, or sometimes even repetitive thoughts of harming the baby. The women in this period will have intense anxiety, crying spells, will not interact with anyone, and will want to spend time all alone, and they might even develop some suspicious ideas. Proper evaluation by a psychiatrist, proper medication, and proper psychotherapy during this period is very, very necessary, because untreated postpartum depression can lead to suicidal ideas in a woman, and it might affect the mother-infant bonding, her breastfeeding practices, and the growth and development of the child as well. So postpartum depression has to be properly treated by a psychiatrist. The next common disorder is called as postpartum psychosis, which is not very common. It affects just 1 or 2 out of 100 deliveries. Postpartum psychosis is characterized by intense suspicion about the people around of whether they will harm her or the child. Intense hallucinations, which could be auditory hallucinations like hearing voices, or visual hallucinations like seeing images when nobody is around. This is a very rare disorder but can be effectively treated with medications. The third most important and vulnerable period in a woman's life is around her menopause, when she stops having her periods. Now, this perimenopausal period usually happens between 45 to 50 years of age. This is the period where a woman is overburdened with a lot of responsibilities like taking care of elderly parents, taking care of adolescent kids, and taking care of herself. Perimenopausal period is characterized by symptoms such as intense anger, intense irritability, feeling sad for no reason, having extreme physical fatigue or mental fatigue, not interested in doing her activities. She might have physical symptoms like not being able to sleep, not being able to eat, and having hot flushes or intense bursts of sweating. Now, this period has to be handled very carefully by proper love and affection from the family, as well as proper relaxation and taking the me time of a woman. And women in this period are prone to develop anxiety disorders and depressive disorders for which proper psychiatric treatment has to be taken. The mental health of women is most important because it decides the equilibrium of the family as well as the mental health of the kids and the next generation as well. Taking care of the mental health is the responsibility of every woman as well as the entire family members. So let us take care of our mental health and lead a proper quality of life. Thank you.